Hello and welcome to Buddhistdoor Global's weekly news highlight. I'm Dr. Justin Whitaker, Senior Correspondent for BDG. This week we highlight the news that Thailand's Buddhist monks were among the first to receive COVID-19 vaccines as the country ramps up its vaccination campaign. We'll look at some recent BDG news and features on Thailand's experience of the pandemic recently, as well as other countries in the region. But first, the news. Buddhist monks in Thailand began receiving vaccinations for the novel coronavirus last week, having been given priority ahead of much of the general population. In Bangkok on May 17th and 18th, some 500 monks received their first dose of the Sinovac vaccine developed in China. With the vaccine, it is hoped that monks can safely return to their spiritual duties, including daily alms rounds and engaging in merit-making activities with Thailand's predominantly Buddhist population. Since the monks can interact with many different people over the course of a few days, they could also serve as spreaders of COVID-19 if they become infected. An official from Bangkok's Priest Hospital, a medical facility exclusively for monks, said, "These activities are putting them at risk where they can come into contact with an infected person. The faster we can provide them with vaccines, the faster they will build up immunity to protect them from contracting the disease from devotees." While vaccinations began in Thailand in late February using the Sinovac vaccine, only around 1.5 million people in the kingdom, which has a population of 66 million, have received at least one dose. The government has since said that plans are underway for a mass immunization campaign beginning in June. That campaign will rely on 35 million imported doses of the Oxford AstraZeneca vaccine, along with 26 million more doses being produced in Thailand by the pharmaceutical company Siam Bioscience. One problem Thailand faces is vaccine hesitancy, but by vaccinating monks, the Thai government may gain greater support for the vaccines from the general public. Thailand is battling its third and largest wave of new infections, with the number of new daily cases rising sharply into the low thousands in mid-April. Total cases in the country are beyond 100,000, with over 700 deaths, according to World Health Organization data. Many of the new cases are attributed to the B.1.1.7 variant first identified in Britain. The variant discovered in India has also been identified by health authorities in Thailand. In January 2020, Thailand was the first country outside of China to confirm a case of the novel coronavirus. However, the country took swift action to secure its borders and introduced health measures that were successful at preventing a massive outbreak of the disease. The country is not alone in seeing a sudden rise in cases after a long period of success. Much of Southeast Asia is experiencing a wave of new cases, with concern that the situation could come to resemble the devastation being experienced across India. Buddhistdoor Global has recently reported on Thailand's efforts to minimize the latest wave of new coronavirus infections, including cutting back on celebrations for Songkran, the Thai New Year, in mid-April, and dramatically shortening funerals to prevent families, loved ones, and monastics from congregating and further spreading the illness. We have also been closely following the impact of the coronavirus in the region, notably India, which has been devastated by its own major second wave of infections. As we wrote in a Buddhistdoor View on May 8th, few could have predicted the severity of India's catastrophic second wave of COVID-19 infections. Experts there have pointed to a number of converging factors, including that the second wave was fueled by people letting their guard down, attending weddings and social gatherings, and by mixed messaging from the government, allowing political rallies and religious gatherings. Kumbh Mela, a Hindu festival by the Ganges, was probably a super spreader event. Because of this widespread complacency, vaccinations were declining, and the vaccination drive, which had aimed to inoculate 250 million people by the end of July, slowed. The perfect storm awaited, especially with the B.11.67 variant that seems to be particularly contagious and is hitting young people hard. Before that, in April, we also looked at India in contrast to neighboring Bhutan, noting that the recent news about the Buddhist kingdom of Bhutan's rousing success in vaccinating 93% of its population in less than 10 days will come as a surprise to many. The country has little developed healthcare infrastructure and many remote villages and valleys where vaccines had to be flown in by helicopter. Television was only allowed in the country in 1999 after the lifting of a royal ban, and the capital Thimphu is the only capital in the world without a single traffic light. Higher education is new, with the Royal University of Bhutan only established in 2003 to help coordinate and oversee a handful of educational institutions already functioning in the country. Bhutan is also steeped in a long-standing religious tradition of Buddhism, so much so that when the vaccines arrived, it was religious leaders who helped set the date for the first vaccinations. In contrast, in India, Prime Minister Narendra Modi urged individual caution, but shied away from issuing a national lockdown in April as cases began to climb. He likewise traveled to pack political rallies even as coronavirus cases rose, and has drawn criticism from religious leaders for neglecting non-Hindus. In these countries, we can see how loose societies might tighten up and tight societies might become looser given certain conditions and leadership. Our Buddhistdoor view was that what is needed both within nations and beyond is a continued tightening. Just as natural disasters or threats from outside might strengthen the cohesion of a country, making it tighter, the COVID-19 pandemic must strengthen our bonds as a human race, and ideally as a species that is just one among millions of species sharing our planet. As Thai monks take the lead with getting vaccinated in Thailand, we are reminded once again that by working together as fellow humans, we can solve this and future crises. As Buddhists and Buddhist nations continue to face the coronavirus pandemic, we will watch and we will share with you what we learn along the way. As always, we will include links to these stories in the video description below. Let us know what you think about Thailand's response to the coronavirus pandemic in the comments below. And as always, be sure to check out our website, Buddhistdoor.net, for more on this story, as well as other news and features about Buddhism around the world.